Hi everyone, welcome back to Be a Nurse They Said. My name is Lainey and I'm so happy that you're here. If you haven't gotten the chance to yet, if you're new here, please go ahead and hit that subscribe button so you can stay up to date on all the videos and shorts that I post on my channel. So this week we're going to talk about study skills and test taking strategies to help you be successful in nursing school. As nursing students, you're going to take many exams throughout your entire nursing school career. So it's important that you understand and have those skills in order to take those tests. First, we're going to talk about study skills. So first, it's important to know when you learn best. Do you learn best first thing in the morning? Do you learn best in the afternoon, in the evening, at night even? So it's important to know when you learn best so you know when you should study. Because if you study at a time that you're not going to absorb any sort of information, it's not going to be beneficial for you. It's important to study in chunks. And by this, I mean take breaks while you're studying. Don't try and sit there for 4 or 5 hours without taking any breaks and study for your exams. After so long, your brain is not going to absorb any sort of information and you're going to have to reread things that you had already read so you can learn and understand that information. So study for a little bit, take a 5-minute stretch break, come back, study again, then take another stretch break just to make sure you're giving your brain time to recover. This will help you to prevent burnout, first of all, and also help you retain information. Schedule time to study for your exams. Actually write down study in your agenda. Keep yourself organized. If you have kids or jobs or anything personal outside of nursing school that you need to take care of, it's extra important that you are scheduling time to study. Block 2 hours out every night so that you can study for your exams. Don't wait until the night before to study for your exams. As soon as you learn information, you should be going home from class that day and reviewing what you learned. That way you can clarify anything you need clarifying. Study every day. Make sure you're putting time aside to study every day. Even if it's just for an hour, make sure you're studying every day after class. This includes even after lecture. Like I said, after you have lecture, go home, study what you just learned. That way you know what you don't understand and what you do understand. This leads me to my next tip is to make a list of muddy points. So if you're studying every day and there's something you don't understand, make a list of muddy points, or in other words, things that you're not totally sure about and you need clarification. That way you can take those to your professor the next time you see them and get clarification on those things. Because if you don't and they stay muddy in your brain and you don't understand them, you're not going to be successful on your exams. My next tip is to study what you don't know. And as silly as this sounds, it feels extremely good to study the things that we do know and we do understand. But what you really need to study is the things that you don't know and you don't understand. That way you can learn and understand that information. So study what you don't know. My next piece of advice is to use the teach back method. You can do this with a family member, you can do this with a friend, you can do this with a fellow student. Go over that information and literally teach someone what you know. If it was something about the kidneys, teach them what you learned about the kidneys that day, then go back to your notes and see if there's anything that you missed. Finally, make sure you're doing practice questions. Don't just study the information, actually take practice questions related to that content. If applicable, do NCLEX style questions so you can kind of get used to what those are like. A lot of times our textbooks have practice questions in them. Be doing those throughout the chapter as you're reading and reviewing your information. And also make sure you're reading the rationales. So don't just say, oh, I got this right. Actually read the rationale to find out why. It's really important to find out the why behind things. That way you really understand. So whether you got the question wrong or right, read the rationale for that question so you really understand that information and you can use that knowledge on possible future questions that you either practice or that are on the exam that you can remember that you learned when you were doing your practice questions. So next we're going to talk about test taking strategies. So you did all your studying, now comes your exam. Now you need to know what to do while you're taking your test. So my first piece of advice is to read the question, read the answer options, and then read the question again. This will really make sure that you understand what the question is actually asking and you're not missing any sort of keywords in that question. Also, in doing this, when you're reading the question, cover the answer options. That way your eyes aren't subconsciously jumping ahead and coming to a conclusion and picking an answer that might not be right. By covering the answers and reading the question, it really gives you the ability to understand what that question really is asking. Then read the answer options, see what you're looking at, and then read the question one more time to make sure that you understood it. My second piece of advice, to be mindful of those keywords that I just talked about. These would be things such as first, priority, highest, not. On nursing exams and the NCLEX, these keywords are usually bolded so they stick out to you, but it's really important that you're looking for those keywords that you don't miss, because on a nursing exam, all 4 of the answers could possibly be correct, but we need to pick which one is the most correct. So when we're looking for that keyword like priority, we may do all of those things, but which one are we going to do first? Which one do we need to do to help our patient the most? My next piece of advice is that if you have trouble reading questions too quickly, you can tap. So what I mean by this is you can either tap your finger or you can tap your leg under the table so nobody even knows that you're doing it, and you tap your finger to each word. So just say, what is the priority in this case? I'm gonna tap my finger to each word, and that really slows your brain down so you can really understand what you're reading, what the question is asking, and you're not missing any of those keywords. So if you're one on an exam to read questions too quickly and jump to conclusions and pick the wrong answer, this may be beneficial for you to tap to the words. My next piece of advice is to not forget your priority setting frameworks. Now, these are going to come more into play once you're actually in your nursing courses and past your general education courses, but it's still good to be aware of if you're in those courses, because you're going to see this when you get to your nursing classes. These are things such as ABCs, airway, breathing, circulation, Maslow's hierarchy of needs, acute versus chronic, stable versus unstable, safety, and what's going to kill my patient first. Out of the scenario, out of what the question is asking, and out of my answer options, what's going to kill my patient first? That's one thing you need to think about. My next piece of advice is to trust your gut. Your first answer is usually the right answer, so don't go back and change all of your answers to different questions. If you're unsure, take your best guess and move on. If you stay on this one question that is throwing you off, then it's going to throw you off for a couple of questions, and you need to get your head back in the game. So go ahead, try out these study skills and these test-taking strategies. See how they work for you. Let me know how they go. Tell me what was helpful. So thank you for watching another episode of Be a Nurse They Said. If you have not already, please go ahead and hit that subscribe button. Don't forget to like this video and comment what you thought. Also, be sure to check out my TikTok and Instagram accounts where I post shorts and updates on my channel. And as always, don't just be a nurse, be amazing like I know you all are, and I'll see you next time.